Mammogram help identify heart disease. New research is pointing to yes. Our medical expert, Dr. Pyle Coley, is with us this morning with more on this research. Thanks for coming in.
Good morning.
So you are a cardiologist. What are your thoughts about this? Is this promising?
Oh, this is incredible. Corey, as a cardiologist, I wish more women understood that a mammogram can actually help to sort of look into the future. It's a little crystal ball for us cardiologists, because if you think about all the little arteries inside the breast, if they start to get plaque or
goes right to your way.
deposits in your 40s and 50s, that actually predicts you having a heart attack, a stroke, or dying from heart disease in your 50s or 60s.
So how does this work in potentially identifying heart risk? Is it an extra thing when you go in for a mammogram, or is it just part of it?
No, it's part of it. So the technology already captures it. So you think about what a mammogram is. It's an X-ray of your breast, right? So of course it looks for tumors. It looks for calcifications in the breast tissue, which are usually a sign of cancer. But then calcifications in the little arteries of the breast, they're called breast arterial calcifications. This is a different type of a calcification. Already picked up on the X-ray, it can suggest plaque or little deposits in the small blood vessels. And if you're plugging up your small blood vessels in your 40s and 50s, like I said, later on in life, you might start plugging up the arteries around the heart, the arteries in the neck that can cause stroke. So a lot of times people don't regularly report this, so it's really up to women. I know when I get my mammograms, I look for that information to see if it's even reported. And if it isn't, then I usually call the facility I had it at and say, did I have any breast arterial calcification?
I was just going to ask you this. So I went for my very first mammogram last week. Thank you.
Yeah.
Everyone do it. It's part of your preventative stuff. When you hit 40, go do it.
For sure.
But I didn't see anything on my report that talks about this. Is it something that you have to call and ask for?
So most of the times we're really in the cardiology community trying to push for radiologists to do it routinely.
Okay.
But federal mandates don't require them to do it. They just require them to talk about the breast density and of course talk about whether you have cancer or not. So if it's not on there, I would say make a phone call and find out, because it's a free screening tool. And if you think about it, just like you said, every woman starting at the age of 40 is starting to get these mammograms every year. So we're starting to get information about their heart disease risk long before they have symptoms, long before they have any signs that they're developing heart disease. And if you intervene at that point, let's say you pick up a breast arterial calcification in your 40s, you can change the trajectory of that train so it never ends up turning into heart disease or blockages in those big arteries.
How often is this found, like from a mammogram screening? Is it common?
It's pretty common, more common than you think. So if you look at overall mammograms, it's about 10%, so 1 out of 10 chance. But if you look at postmenopausal women, it's up to 26% of the time. So if you're past menopause, there's actually a 1 out of 4 chance. Now you can imagine it's got a better predictive value in the younger women, which is where we're really bad at predicting risk as cardiologists, right? We're good at predicting risk in older women because once they've hit menopause and they have the usual risk factors, we kind of know those are the women that we've studied. But it's that 40 to 60 range, which is so critical, where we don't have great tools to predict risk. So finding this in 1 out of 10 women and then potentially changing how you manage their cholesterol, their blood pressure, their blood sugar, their cardiometabolic risk factors could really be huge.
All right, just a few seconds left. What should every woman be looking for in her mammograms?
3 things. Okay, I want you to make sure you look on yours as well.
Okay.
Tumor or not, that's that BI-RAD score, whether you have any kind of lesion, tumor, cyst, whether or not you have dense breasts. This is really important because 50% of women can have dense breasts, and those women will need a second screening, either an ultrasound or an MRI. And the third is that breast arterial calcifications.
All right, the more you know. It's so great. Dr. Coley, thank you so much for coming in. We'll be right back.